Hello and welcome to this episode in our series on neurodevelopmental disorders. Whenever it comes to neurodevelopmental disorders, people always ask the question, are there any medicines? Do medicines or medications cure disorders such as ADHD? So in this episode, we'll try to understand the role of medications in treating attention deficit hyperactivity disorder or ADHD and its safety. Come, let us meet our expert.
If we try to explain it in simple terms, someone who has vision problems would say that when they keep eyeglasses, they are able to see the world better. Similarly, when medications are given to a child with ADHD, they are able to focus better, or in other terms, they are able to attend to activities that is necessary for them and avoid distraction, which in turn helps them function better. So, it is known that in ADHD there are certain functional brain pathways which are not functioning adequately, and that brings about the symptoms of ADHD. So, when we are giving medications for ADHD, these medications act on these functional pathways through certain chemicals in the brain called neurotransmitters, and this modulation will help pacify or decrease the symptoms of ADHD, which in turn will improve the functioning of the child. So, the most common or the first line treatment that is often used in ADHD are stimulants. Though there are multiple stimulants in the market, in India we only have methylphenidate as the drug. So, studies have shown that more than 80% of the children, when given the correct stimulant medication and dosage, they function relatively much better. But it is important to note that methylphenidate is a controlled substance, means it can only be prescribed by a registered medical professional. There are also other medicines, not stimulants, like atomoxetine and clonidine, which also bring about similar effects like stimulants but may take a longer period of time. So, the choice of medication, what is the best fit for your child, will depend on the profile of the child, that is the clinical profile of the child, if the child has any other psychiatric or medical disorders. So, most side effects of ADHD medications usually happen in the initial phases of starting treatment. They are usually mild and they usually subside by themselves. And the most common side effects that parents usually report are decreased appetite, there can be weight loss, there can be stomach upset, there may be anxiety symptoms, mood symptoms, and very often as the efficacy of the medication is settling down or the blood levels of the medicines come down, some parents also report child being more hyperactive or dull during those times. So, however, if these side effects do not settle down after the initial few weeks of starting the medicine, it becomes important that we may have to make changes in the dose of the medications, maybe change to another formulation of the medication, or sometimes even altogether change the medication. So, these medicines, when prescribed by a medical professional and used under the care and supervision, can be used for long term with no considerable side effects. No, medications do not cure ADHD, but they help to decrease the symptoms of ADHD so that they can bring about better functioning in various areas of their life. So, when these medicines are taken under the supervision of a medical professional, the chances of habit formation or addiction are substantially low. It is also important in this context to understand that adolescents or adults with ADHD, they have very high risk of developing substance use disorders, and those who are untreated or those who are inadequately treated seem to have higher risk than those who are adequately treated for ADHD. So, ADHD is a neurodevelopmental disorder. So, that means that they may require to take medication for a longer period of time for optimum functioning. And it is also known that 50% of children with ADHD grow into adulthood having similar symptoms. So, for how long they have to take the medications may vary based on a case to case basis. Now, if you actually go by guidelines, for children less than 6 years, the American Academy of Pediatrics, they recommend only behavioral treatment as a management for ADHD. The reason being, there are no FDA approved medication for ADHD. However, we have substantial amount of research evidence to show that methylphenidate can be used with relatively good efficacy and safety in children less than 6 years. And when using these for preschoolers, it has to be started at a very low dose, and it need to be incremented at small doses with constant supervision by a professional. Now, if you look at children above 6 years, all guidelines, they recommend treatment as a combination, that is with medication and behavioral management. Most importantly, we need to understand that medications do not change the behavior. It does not teach them social skills. It does not teach them academic skills. So, along with medications, a child with ADHD will require substantial support in form at home, at school, and also in the community level, so that there can be a holistic development of the child.
This concludes today's episode, where we dealt in detail about medications used to treat attention deficit hyperactivity disorder. We understood why medications are required, what are the types of medications used, are there any side effects, how long the patients have to take these medications. We'll be back with our next episode. Namaste.